The title is Worsening of Lower Urinary Tract Symptoms by Proton Beam Therapy for Prostate Cancer is ameliorated by morning irradiation. I'm Hiromitsu Negoro from Department of Urology, University of Tsukuba, School of Medicine, Japan. I have nothing to disclose. Proton beam therapy for localized prostate cancer is a promising therapy since it has relatively low adverse events and maintains quality of life. On the other hand, it often induces lower urinary tract symptoms, especially urgency, frequency, in acute phase reaction. And the effective treatment for it has not been available yet. Recently, it has been reported that the difference of time of day for irradiation has influenced the treatment efficacy and adverse events. That is advocated as chronoradiation. So, we investigated the influence of the time of day for proton beam therapy on the prostate cancer in our hospital. (173 patients who received proton beam therapy for prostate cancer between 2013 to 2018 were included. Among them, 5 patients who did not fulfill the IPSS questionnaire were excluded. Total of 168 patients were separated to the 3 groups based on the time of radiation: morning, around noon, and late afternoon. IPSS was obtained 4 times at baseline, last week of proton beam therapy, after 3 months, and 6 months. The characteristics of the patients are shown here. Number of patients, age at proton therapy, median is around 68 years old. Initial PSA, Wilson score, clinical T stage, NCCN risk classification, androgen deprivation therapy. So in general, low-risk patients did not receive androgen deprivation therapy, while intermediate and high-risk patients received neoadjuvant ADT for 6 months. High-risk patients continued ADT as an adjuvant therapy for a total of 3 years. And clinical target volume, IPSS total score, severity of IPSS, IPSS cure score, LUTS medication use before PBT, diabetes, anticoagulation therapy. Results. Changes in total IPSS score from the baseline is shown here. Morning, around noon, and late afternoon. The time of day morning was the only determinant factor at end by multiple linear regression analysis, including various variables. These significant differences of the time of day were not observed at 3 months or 6 months. Changes in IPSS cure score from the baseline is shown here. Similar to the changes in IPSS total score, time of day morning was the only determinant factor at end by multiple linear regression analysis. These significant differences were not observed at 3 months or 6 months. Discussion. Why does time of proton beam therapy influence on the adverse events? Humans have a diurnal rhythm that is generated by an internal biological clock The central clock regulates peripheral clocks in local tissue and cells. One hypothesis is that the circadian clock exerts a protective effect on local tissue and cells following irradiation, particularly in the bladder. Another hypothesis for the protective effect of radiation therapy is that the higher level of antioxidants in the body, such as melatonin, in the morning. Conclusions. Our findings suggest that the morning proton beam therapy for localized prostate cancer can ameliorate the worsening LUTS and QOL in the acute phase compared with the treatment around noon or late afternoon. Current radiation therapy for prostate cancer may be an effective way to ameliorate worsening LUTS in the acute phase, but further prospective clinical study and basic research are necessary to establish a higher level of evidence and to investigate the mechanism of this effect. Thank you.